Next governor, please.
Hey, this is Phil Murphy.
You're looking well, Phil. You're looking well.
Mr. President, so are you. Good to see you and the Vice President. Thank you for everything.
Thank you.
Just a couple quick points. We've had a really good week with FEMA, so I want to give them a shout out. FEMA Region 2 is helping us
Good.
set up testing. The Army Corps is actually visiting us in this building at 4 o'clock today to talk about repurposing facilities for more beds, so thank you for
Good.
that.
Yep.
We've had conversations with the VA in terms of backup medical support. Two areas, one, just in terms of where we're gonna need some help. One is to underscore Governor Kemp's point on flexible block grants.
Okay.
Those will be important to us to allow us to continue to serve our people. And secondly, the Lord helps those that help themselves. I promise you, we're doing everything we can to get PPE. We're acquiring it. We're getting donations, but we still are going to need a big slug out of the strategic stockpile. So for all the above, many, many thanks.
And so, Phil, try what you can, do the best you can to get what you can actually get. And we're also having a lot of things produced that, frankly, nobody's ever seen anything like this before. But do the best you can, and on block grants, we're going to consider that very strongly. Thank you, Phil.
Thanks, Mr. President.
Hello, John Bell.
Mr. Vice President, appreciate the communication, the coordination, all the help. I did want to just put on your radar screen the fact that I think if you look at cases by state on a per capita basis, we're right at the top of the country, 3 or 4. And of course, the healthcare infrastructure is designed to meet the population. And my fear, based on modeling that I've received today, is that as early as 7 days, we can start to exceed our capacity to deliver health care. And even after surging, we may only get an additional 3 days. And so I'm asking for help in terms of surging our medical capacity here in Louisiana. We've got some requests in. For example, we have a VA hospital in New Orleans where we've requested to be able to surge patients there. We haven't received a response yet. We've got a request in for a federal medical station through HHS. We're just asking for help. That is the 10-meter target for me right now, because we're going to do everything we can to mitigate and slow the spread. But in the time that we have, we've got to increase our surge capacity. That is my biggest concern, and I just wanted to express that to you and ask for your ongoing help.
What is your second request? John Bell, what's your second request, please? The second request.
Well, the second request beyond surge capacity is looking at National Guard and bringing them under Title 32 for funding purposes.
Right. Okay. We're going to look at that, and I'm going to try and get you immediate approval on the hospital. I know about the hospital request, and so we're going to speak to the VA. We're going to see if we get immediate, at least as a switch, but we'll get that approved for you one way or the other. All right?
Thank you very much, Mr. President.
Okay. Thanks a lot, John Bell.
Thank
you. I might ask very briefly while we're waiting for the next governor to come on, Mike, if you could say a few words, and also Deborah, if you could say a few words, would be great. And then we have another governor teed up, please.
Great. Again, thank all the governors for your leadership, your partnership in confronting the coronavirus. A few updates and a few requests for each one of you. I want you all to make your citizens aware the President signed the Family First Coronavirus Response Act last night. Coronavirus testing is free. Paid sick leave, family leave for caregivers, food assistance to the needy. Get the word out to your citizens to be very helpful. On testing, as we've said many times and worked with many of you through your state labs and certified labs, and of course at the CDC, testing is now available in all 50 states. We want you to be aware that if you have questions about the availability of testing in your state, you obviously can talk to your state health department and healthcare providers. But I want every governor to know that because of the public-private partnership that the President forged with our commercial labs, Roche, Thermo Fisher, and as of last night, Abbott Laboratories are now coming online literally by the hour, and When they are done, we will have some 2,000 labs stood up around the country with the high throughput testing. Your healthcare providers will know where those resources are. Your State Department will know where their resources are, and we just encourage you to bring your team together. Important to note that while now tens of thousands of more tests are being performed literally every day, the bill the president signed last night also included a provision that states and private labs must report all coronavirus testing results to the CDC. Emphasize that to your state health department, your healthcare providers. Encourage you maybe to pull them together today before end of business. We're rapidly expanding testing around the country, but as Dr. Birx will reflect in a moment, we want to make sure that we're getting the results of that testing so that we can be informed about that, and of course that the American people can have full visibility on that testing as well. She'll also explain we will see, as testing is ramping up today and tomorrow, we will see an increased number of cases. We want to give context to you and to your citizens about that. On supplies, President Trump has been engaging industry leaders in the supply chain across the country to make sure that personal protective equipment and medical supplies are broadly available. On the subject of masks, I've talked to many of the governors about N95 masks. Again, in the bill the president signed last night, we have literally unlocked tens of millions of N95 masks. What the president asked the Congress to do, and they did, was we extended liability protection to all industrial N95 masks, so those can now be readily sold to your hospitals and healthcare providers. We urge you to communicate that to your healthcare providers, your hospitals today, to let them know that that supply has dramatically increased and they can place orders. We also would reiterate, if you can reach out to your construction companies, they're in possession of lots of N95 industrial masks, and the president is urging all those builders, and literally hundreds around the country have already done this, to donate those masks to their local hospitals and clinics. On the subject of ventilators, we are currently surveying healthcare providers around the country and suppliers, and I'm pleased to report to you that we have already identified tens of thousands of ventilators, including ventilators that can be converted to treat coronavirus patients. Your action item on that in your state should be you should survey your outpatient surgical centers and your ORs to identify the type of respirators that can be converted. Dr. Birx has been working with suppliers. There's a changed vent that has to be attached. We've identified that those are available, but literally tens of thousands of ventilators are now going to be available because of the survey that's currently underway. The other point that we wanted to emphasize is at the direction of CDC and the President's Coronavirus Task Force, we are encouraging hospitals and every American to postpone elective surgery. Please explain to your citizens that this will have a direct impact on hospital capacity. By suspending elective surgeries, it will free up more space in hospitals, including respirators. As Dr. Birx explained to me, that many people that require a respirator is because of a surgery gone wrong, and so this frees up more of our capacity across the board. I know it's not lost on any of the governors here, Mr. President, that by standing up FEMA, you now have essentially created a structure that every governor is very familiar with in dealing with disasters and emergencies. We have activated all emergency support functions and interagency functions here. Pete Gaynor is here for comments and questions. We intend to run all of the federal response and support to states through here at the National Response Coordination Center and through FEMA. This center is fully operational. Governors, I want you to tell your teams that this NRCC will be connected to your states through your regional administrators, and your state emergency operations center. This will be very familiar to all of you. Any questions that you have, the only thing that I would ask on the President's behalf, if there are issues that arise in your state, begin with your regional FEMA administrator. Literally 20,000 people work for FEMA. You all know what incredible people they are, and they're ready to go to work your issues. So with that, Mr. President, I might just turn it over to Dr. Birx with your permission, and she'll reflect on what we know about the data and what we know about the spread of the disease. But thank you for your bold leadership. Thanks for what you all are doing to implement the President's coronavirus guidelines. It's an honor to be serving with all of you.
Thank you, Mike.
Mr. President.
Deborah?
Thank you, Mr. President, Mr. Vice President. You should have received an analysis of the across the country COVID cases analyzed by state and counties, utilizing counties with more than 50 cases. Over 50% of the cases are in 3 states. Over 50% of the cases are in just 10 counties. So it's the 3 primary states of California, Washington, and New York, with the addition counties of New Orleans and Cook County. We are very concerned and remain concerned in urban areas where mitigation and social distancing is absolutely crucial. The issue of decreasing spread due to contaminated counters and other things in restaurants and bars, as well as movie theaters, is absolutely critical. So I know you're concerned about your hospitals, but critically, you need to make sure that all elective medical and surgical procedures and dental procedures have been canceled, that PPE is being utilized and transferred to the parts of your state that need it the most, that you look at all elective surgery centers, those are your outpatient surgical centers, and that staff to be your surge capacity. Those ventilators can be converted to be utilized, anesthesia ventilators to be used as ventilators. I think as we all work together to solve these solutions, I think unlocking the masks and the PPE from construction was absolutely key, as well as this ventilator situation. I think the federal government has been very proactive in ensuring that we've decreased bureaucracy and barriers to unlock these innovations. We believe that innovations will continue to come from the field, and we appreciate your frontline workers who have been informing us about their changes. It's important that we're tracking the data on a county by county as granularly as we can, because we can look at whether mitigation is working in those. We'll get feedback from your community. This will only be solved if every single person in every single community takes responsibility to ensure they're following the presidential guidelines that were put out several days ago for the 2 weeks of stopping this virus. So we will stay in close communication with all of you through FEMA. We're very excited about the full activation of FEMA to be able to provide a dialogue both up and a dialogue down so that we can stay in closer communication, and so we can ensure that we have prioritized all stockpile elements based on the needs and the case structure that has been reported. Reporting becomes critical. If we can't see it, we don't know how to unlock the stockpiles. So this, both test negative and test positives, are going to be absolutely essential, as well as hospital admissions and CCU beds, so that we understand exactly what is required from the federal government. Thank you, Mr. President.
Thank you very much. Mike, go ahead.
Thank you, Mr. President. Just 2 brief points on the subject of testing. Admiral Goa is with us. The U.S. Public Health Service has built a model. So many of the states have already begun drive-through testing, are doing a yeoman's work in that space, and Admiral Goa is here to articulate to you how we can be supportive of that going forward and where we're rolling that out. Last point, the President asked me to emphasize, we want to encourage every governor on this call to convene your leading healthcare providers today to take inventory of your medical supply needs, and we urge you to remind them that they need to look to their supply chains first. We'll prioritize accordingly, and any states that are in the middle of critical response know that we will work with you to get you what you need. Other states, you need to talk to your healthcare leaders, providers, and make sure that they are going to the supply chain. And we encourage you to pull them together today to emphasize that point. Thank you, Mr. President.
And thank you very much, Mike. And I want to get back to the governors. I do want to say, to me, something so big. The FDA has approved a compassionate use for a significant number of patients. We have a drug called chloroquine. A derivation would be hydroxychloroquine, which I hear even better about. It's a common malaria drug. It's been available, so therefore the safety level we understand very well. It's been relatively safe, and it showed very encouraging early results, really encouraging. If this works as well as hopefully it might, the FDA, which would have taken normally much longer to do under our great secretary, has been fantastic. The head of the FDA has been Dr. Hahn, Dr. Stephen Hahn. He's been fantastic. He got it approved very quickly. I won't even tell you how quickly, but let's put it this way, it's approved. And we're encouraging you to take a look at it. We have ordered a lot of it, and you can too. It's by prescription. It's a very powerful drug for malaria and also for various forms of very serious arthritis. But we think it has a very serious, very good impact on what we're talking about with respect to the virus. So you'll take a look at that and you can coordinate with us. But I think to me that's a game changer. You know about the vaccines are fine, but that will be a while before you can test them because you have to leave quite a bit of period. We are making tremendous progress on a vaccine, but it still takes a long while to test it. We're also studying this and other promising therapies, which is a therapy produced by Gilead, and that would be it's called remdesivir, and it shows great promise. And Regeneron is a company which is also working very hard on a drug, and it's also, they're doing very well. They are the ones that came up with a very successful solution to Ebola. And they've been a fantastic company. So we have some great things, but the ones that I mentioned are very good, but especially I think if you look at the first mention, could be a absolute total game changer. And with that, I think we'll go back to this is by prescription, but states can issue it, and we have it approved by the FDA. And I think it's going to be something that will be very interesting to see. We're going to know very quickly, but we've had some very good tests, and it's been successful. So let's take a look. To me, that's probably the most important thing that anybody can say, if it works. But we have it approved for safety. And I want to thank the FDA for acting so quickly. It was incredible how quickly. This was something that would have taken years, and they got it done almost immediately, based on the past history of the drug. Thank you very much. Who is the next governor, please?
Hi, this is Pete Ricketts in Nebraska.
Hi, Pete.
How you doing, Mr. President?
Thank you.
Good. Thank you very much for all your leadership and the Vice President. Appreciate it. Absolutely, the key things we're hearing from people are around PPE and testing, so you're doing on the right track with that. We need to expand the access for those. I got 3 quick things to bring to your attention. One is reagents to process the test. So once, for example, somebody's been swabbed and we have a test kit, sending it to our lab, we're working to conserve the reagents, but I think some of my colleagues are actually out. So if you could put some attention in the CDC to how we can make sure we're getting reagents out to everybody so we can actually process the tests we're getting.
Okay.
That would be a key thing. Second thing, childcare. Following your directive from Monday, we've reduced those public groups to 10 people, but we need to pop up an alternative daycare, especially for our first responders, our health officials, anybody involved in public safety. So we need a waiver from the fingerprint requirement to be able to do that quickly. So I want to put that on your radar screen to be able to see if you can have somebody take a look at that.
All right,
get
great.
moving on that.
Good.
And then finally, guidance from on special ed from the Department of Education for the free appropriate education requirements. Please ask somebody to work with the chief state school officers on a temporary approach. The recent guidance that was put out actually created more consternation, more concern. I've got attorneys in some of our schools telling our teachers they can't do anything because they're going to get sued because of the FAPE requirements. So if we could have some temporary guidance that would allow us more flexibility, you know, our schools again are operating without students in them. We'd like to be able to use them for other things, and this
That's
apparently
great.
is a barrier for getting that done.
That's
So,
great.
thanks for your help on those
We'll get
things.
right back to you on that, Pete. Thank you very much. Great job you're doing. Thank you. Okay, who's next, Governor? Who's our next governor? Next.
Hey, Mr. President, Vice President, this is Governor Baker from Massachusetts.
Hi.
First of all, I want to thank you for signing the Family First Act. That will certainly provide needed resources to all of us. And I'll obviously echo the argument that other governors have made that more flexibility is better than less with
Right.
respect to additional federal support, just given the way we all work. I just have two things on the PPE issue, which obviously is a huge issue for all of us. The first is, could you talk a little bit about the guidance you're going to offer, or just give us some guidance on how the implementation of the Defense Production Act is going to work with respect to trying to man up and generate additional capacity around the PPE stuff? And then the second thing, and I'm not quite sure what to do with this, so I'm just going to throw it out there for you. We took very seriously the push that you made previously on one of these calls that we should not just rely on the stockpile and that we should go out and buy stuff
Right.
and put in orders and try to create pressure on manufacturers and distributors. And I got to tell you that on 3 big orders, we lost to the Fed. So my question is, could you give some of these guys some guidance that says, you know,
Yeah.
if states are doing what the feds want and trying to create their own supply chain on this, that people should be responsive to that? Because
Good.
I got a feeling that if somebody has a chance to sell to you or has a chance to sell to me, I'm going to lose every one of those.
All right, Charlie, thank you very much. Well, we do like you going out, seeing what you can get, if you can get it faster. And price is always a component of that also. And maybe that's why you lost to the feds. I'll tell you, that's probably why. But I'm gonna ask Mike to discuss that because we have some, I think, brand new information, please. Mike?
Well, Charlie, we will take that back and appreciate the feedback. Secretary of HHS is here, and we want to facilitate all the states and the healthcare providers in your states to be able to access that supply chain as it becomes more robust. Specifically on the Defense Production Act, the president has activated the Defense Production Act, but he's not initiated any other action underneath it. And right now, what I can tell you is, as the president has brought together leaders of business and industry and supply chains, I think, Mr. President, you put it well when you talk about the spirit in American business about wanting to ramp up voluntarily to meet the needs that our healthcare providers have in this country is truly inspiring. And so the president has not yet exercised his authority under the Defense Production Act. He said he will if he needs to. But I think the president's perception, the team's perception is now, is American industry is stepping forward very aggressively, and with the changes that Congress just enacted and the president signed, we're going to continue to make more and more PPE available.
And I will say this, Charlie, and for everybody, the country has really stepped up like I don't think we've seen it in many, probably decades. It's incredible the way they've stepped up. So we hope we can get rid of this thing quickly. Okay, next guy. Thank you, Charlie. Next governor, please. Next governor.
Mr. President, Mr. Vice President, this is Larry Hogan, Chairman of the NGA. First of all, I just want to thank you so much for this call today, and I want to thank you for the great communication that you've had with all the governors over the past few weeks. It's been tremendous. Mr. President, thank you for signing the second stimulus last night and for your ongoing efforts to mitigate the economic impact that we're all facing. And thank you so much for appointing Vice President Pence, a former governor, to lead this crisis. He's been terrific in working with all of us and reaching out to us.
Thank you, Larry.
Yesterday we had a meeting of all the governors at NGA prior to this call, and we were getting you're getting a lot of input. You're being bombarded by 50 different people with different questions. We tried to consolidate it down to kind of a group of concerns that all the governors agreed on were sort of our priorities. And we talked with Doug Holzer last night and gave those to the White House. And we want to just raise those issues, some of which you've already covered already in the discussion, but I just want to walk through them. Just summarizes, there were 25, 30 different things all the governors were talking about, but these were the ones that were the most, there was most consensus on.
Go ahead, Larry.
One, it was, trying to dedicate at least 50% of the supplemental funding to the states, including some direct funding and acting quickly on waiver requests. You've done a great job with all this funding. We're in a good position at the state level to know the real needs and get the money out faster to some of those small businesses that are impacted. You're doing the stimulus for those industries that are being hurt and getting those checks out to the people that need them. But if we have the money in the states, we can really utilize it, I think, faster and push it out, sort of like we do on other things with block grants. Secondly, we've talked about this a lot, but every governor obviously is trying to work with you and bombarding about things about how do we work together to increase access to PPEs, mass test kits, extraction kits, and accelerating the production and all of this life-saving equipment, ventilators, and we're working together, but that's obviously something all 50 governors are at the top of their list. Third, and this came mostly from your appointees, Mr. President, the co-chairs of the Council of Governors, Governor Hutchison and Governor Ige, about supporting Title 32 authorization to give governors more flexibility with their National Guards, and it helps us pay those folks and get them benefits that we've activated 2,200 Guard members in our state, and this is something I think the governors had a concern. All 10 of your appointees are on this call, I believe. Providing some guidance on implementation of the Defense Production Act so we can kind of help work with Secretary Azar and give some thoughts about how the states could be more involved in helping that with some of the industries in our states. And lastly, allowing us some more flexibility for the completion of both the census and the real ID. Because we're trying to not force people into like our MBAs. We've waived licensing requirements, so we don't have people trying to get renewals of licensing, and yet real ID requires us to get all these people in there by October 1st. So those are kind of five little things that all the governors want to address, some of which you've talked about. And I just want to, again, thank you. There's been tremendous cooperation. You have a terrific team that's been working. And I want to try to limit the people bothering you directly and calling the vice president's phone and blowing up cabinet secretaries. So I'll reiterate what I talked with the White House about last night, and that is, you mentioned it, Mr. Vice President, going through the normal FEMA process. It's great that you're being so willing to help governors personally, but I think things will happen better if you go through your regional FEMA coordinators and you got more people addressing these issues. But that's a summary of it. I just throw it out there, so thank you for maybe others on the team can touch on it.
Well, thank you, Larry. And I think the FEMA is going to go great. We've done so much work with FEMA. Unfortunately, recently on a big tornado in Tennessee, you know that, and then last year on a big tornado in Alabama, and plenty of hurricanes. And we work also in California, largely in California, the big forest fires, and FEMA does a job like no other. So I think they'll be I know they're going to be a tremendous help. On the 2 points that are relevant, I'd like you to call Steve Mnuchin, and I'll speak to him later. Give him a little detail on those 2 points, please, so that while we're doing this with the Senate, we're getting a lot of cooperation from Democrats and Republicans. Maybe you can make those 2 points a little bit with Steve, because a few people do agree with that. Okay? Thank you. Thank you very much, Larry.
Thank you, Mr. President.
Okay, next governor, please.
Mr. President, if I might, before the next governor speaks, I might, with your permission, Pete Gaynor could give us a couple minutes. Governor Hogan, we appreciate your affirmation of the President's decision to stand up FEMA's National Coordination Response Center and to have all the state requests and resources funnel through a very customary system here at FEMA. But, Mr. President, with your permission,
Yes,
have Pete
please.
reflect.
Pete?
So, Mr. President, Mr. Vice President, welcome to the National Response Coordination Center. And as the Secretary and the Vice President yourself has announced previously, FEMA is the leading federal operations, or is leading federal operations on behalf of the White House Coordinated Task Force, who oversees the whole of government response to the pandemic. Like all of you, we are prepared to do this for the long duration, for the long haul. The health and safety of our employees and the American people is my top priority. As of this morning, the HHS Crisis Action Task Force and other federal partners have fully integrated into the operations base here at FEMA's National Response Coordination Center. Additionally, all 10 FEMA regional response coordination centers around the country have been activated to support ongoing response efforts in each of your respective states and regions. Currently, there are 50 states, the District of Columbia, 5 territories, and 1 tribe that have opted in and have received the 501(b) emergency declaration for COVID-19. In support of this, FEMA's primary goal will be to ensure you have the resources that you need. This is what FEMA needs from everyone. The FEMA regional administrators will continue to coordinate closely with you and your teams to determine the type and level of support you need as you continue to respond to this dynamic threat. Like all emergencies, response is most successful when it is locally executed, state managed, and federally supported. And we cannot stress this enough. At the state level, it is important that your emergency management and public health teams are linked together. Governors, if you have unmet needs, please ensure they are communicated to your respective FEMA regional administrator. They have a direct line here to the NRCC in Washington, D.C. I also need your help in emphasizing that at the local and county level, they should first be funneling requests up through the state and then from the state to the FEMA regional administrators. Again, locally executed, state managed, and federally supported. Recently today, we issued guidance to all states about what eligible emergency protective measures are under the Stafford Act. So that was this afternoon, and governors, you should see that shortly. We also issued guidance on giving more definition about the Defense Production Act. I thank everyone for the continued partnership in this effort, and as the President and Vice President said, we will get through this together as a team.
Thank you very much, Pete. And in addition to FEMA, we have the very, very talented man who I've dealt with a lot on building different things throughout the country. The general that you, I think for the most part, you know, General Semonite, and that's the Army Corps of Engineers, and very much involved in a couple of locations, I know very specifically. And he's definitely very busy, but he's a good builder, and that's what you need is a good builder. So thank you very much, General, for being here. Okay, next governor, please.
I don't know.
Good afternoon, Mr. President. It's Gina Raimondo from Rhode Island.
Hi, Gina. Hi. Go ahead, Gina.
Hello, can you hear me?
Yes, yes.
Hi, sorry about that. Good
That's
afternoon, Mr. President and Mr. Vice President. I also want to echo what others have said and add my gratitude for your transparency, and especially the Vice President, who's been very gracious and generous with his time and getting on the phone with me a few times. I very much welcome the opportunity to work with FEMA, and I know we're in good hands because prior to coming to D.C., Pete Gaynor was my EMA director here, so you picked a fine man.
That's
and
good.
It gives me confidence to hear his voice on the line.
That's great.
Let me just, I agree with everything that's been said. I want to just add a few other points. One is we are following your direction and asking our hospitals to suspend their elective surgeries.
Great.
For all the reasons you've asked us to do that. That is, however, an incredibly important source of revenue for these hospitals and profit.
Right.
So as you are putting together the next round of stimulus, I would ask you please to consider direct and sizable stimulus to our hospitals, because they're really bearing the brunt of this.
Okay.
The second thing is, and I talked to Secretary Mnuchin yesterday, and he agreed with this. I would ask you to think about the short-term liquidity needs of states So as our revenue is falling off a cliff, we may need to access the capital markets for kind of bridge financing to deal with short-term liquidity. And some sort of a federal guarantee or federal assistance to help us do that would be helpful.
Okay.
And I think some of us may need that help in a matter of weeks, not months. So I just wanted to put that on your radar. And then I fully support what has been asked for as it relates to block grants, because all of us are on the ground and need some flexibility to quickly react to the needs of our small businesses who, these guys are really struggling, and we're all going to have to do our best to help them. So Thank you.
Thank
again.
you.
And by the way, thank you for having these calls. Incredibly helpful, and I appreciate it.
Thank you, Gina, very much. Appreciate it very much. And we'll look into all of those points very strongly. Thank you. Gary, please, go ahead.
Am I on? Hi, this is Gary Herbert, Governor of Utah. Thank you very much, Mr. President, Mr. Vice President. Let me add my amen to all that's been said heretofore, and we appreciate the work that's being done, and the suggestions and what we're learning from each of the states is helpful as we look at best practices. One of the things I'd like to just suggest is that we hear a lot of what we can't do. There's a lot of gloom out there. People are uncertain. They're afraid. We need to bring some certainty, if we can, to when this is going to be end. How long have we got to tread water here? The stock market is in kind of a free fall. And yet, as we look at least in my state of Utah, I think around the country, the economy is still doing pretty good. We need to start talking about what we can do. There are things we can do. There's best practices. What we can do is workarounds. And probably we need to hear from our people in the hospitality industry about what could they do with their restaurants, maybe meeting in small groups and still be able to keep people safe from the spread of this flu rather than total shutdown. So I'd like to hear more about what we can do. For example, I know this will, you agree with this, Mr. President, golf is a great recreation, a great activity where we have very few people in a large open space. Our golf courses ought to be a place of recreation. We probably have park areas that we go out there and recreate with our families and still have a normalcy to our lifestyle. So it's not just what we can do, but what we can do and what we can find from best practices to see what we can do to adapt, innovate, and be able to succeed during this troubled time. So I'd like to hear more optimism to give us hope and confidence in the future, which I think will translate to the public.
Good. I think you're right 100%, and I think we're going to have we're going to be a rocket ship as soon as this thing gets solved, as soon as we beat the invisible enemy. It's an invisible enemy, and it's been vicious. It's in over 140 countries, if you can believe that. 140 countries, so it moves fast. It's very contagious, but we've really stepped up, and a lot of good things are going to happen. And one of the reasons we're doing the packages that you're hearing about, reading about, and know about is the fact that we think it's going to come back really fast. I think we're poised to come back very, very fast, but we have to get rid of this, and we will get rid of the virus, and hopefully it'll be sooner, far sooner rather than later. Thank you very much, Gary. Appreciate it. Thank you.
That's great.
Next governor, please.
Good admonition.
Mr. President, this is Gretchen Whitmer from Michigan.
Hi, Gretchen.
I'd like to be on the call with you. I want to thank you for the policy on the Canadian border. Michigan relies on a lot of medical care professionals coming across that border, and so grateful that it was a thoughtful policy.
Good.
And, I'm not going to waste your time echoing all the comments my colleagues have made, though I see the wisdom, and I'm grateful that they've made them. I wanted to just quickly touch on the auto industry. Obviously, coming from Michigan, my colleagues across the country also have serious investments from the auto industry, and we're concerned about liquidity up and down the supply chain and all of the great people that have made the backbone of our economy hum for so long. And I'm just hopeful that as conversations happen around industry and we will keep this important sector front and center, because we are concerned about ensuring that they have got some paths out to and back to prosperity as well.
Well, thank you very much. You're right, 100%. We're watching the auto industry very much. We're going to be helping them out at least a little bit, and they've sort of requested some help, and it wasn't their fault what happened. So we'll be taking care of the auto industry, and I appreciated very much your comments. Thank you. All right, next governor, please.
Thank you.
Mr. President, Mr. Vice President, this is Governor J.B. Pritzker from Illinois. I wanted to first express my gratitude to your staffs and to others working in the administration who we've interacted with. They've really done yeoman work in being responsive to us. And thank you, Mr. Vice President, for returning calls to us as we've needed more help with answers to questions about testing. And actually, that's why I wanted to ask a question today. We understand that there is drive-through testing that's being stood up across the country. We hope to see it in Illinois, drive-through testing that the federal government has arranged. But we understand that there are only about 5,000 tests that will be provided to us in Illinois for these drive-through testing centers, and then there's no more promise after that. And so I wanted to try to understand, if we stand them up, what will happen. That's perhaps, a day or 2 days of testing. Obviously, it's on top of the testing we already have now, but what will happen after the 5,000 run out? How do we get more?
Okay, the states have done a lot of that themselves, working in conjunction with us. A lot of the drive-through has been done by states. But Admiral, maybe you could answer that question, please.
Yes, sir. Thank you, Mr. President. Mr. Vice President, couple of numbers for you. Right now, we're very effectively transitioning to large-scale testing by leveraging all components of our American healthcare system, including CDC and the state public health labs, healthcare and hospitals and large commercial labs. Let me give you a few numbers. Between March 2nd and March 14th, we made available 10.4 million tests to the United States population. We anticipate by March 28th, that number will be 27.6 million tests, according to the FDA, so an incredible surge. In terms of supplies, which many of you I've worked with, probably about 20 individually, the FDA has made available a number of options for supplies, different swabs, different reagents. If you don't have culture medium, you can use sterile saline, salt water, it works good. Everybody has that. That's on the FDA FAQ website. And in general, the commercial market is working extraordinarily well. The CDC and the public health laboratories to date have conducted over 45,000 tests, and the clinical laboratories, the large clinical laboratories, have now conducted over 63,000 tests, of which 20,000 were done just yesterday. So this shows the incredible ramp. We do not have all the tens of thousands of hospitals which Ambassador Birx is talking about. I wanted to highlight one, before I get to your question, that the approval by Abbott, the approval by the FDA of the Abbott testing system is very important to your hospital systems because it spans a little bit of a gap between what's done at your state lab and what's done at the large commercial laboratories. There are about 175 of these systems throughout the country. 150,000 tests were released yesterday, with about 1 million more coming over the next week. These are in 175 of your community hospitals and academic medical centers, VA medical centers, and they can do about 500 tests per day within your hospital system. Now, in terms of the drive-through, this is the last part. We are standing up 47 sites in 12 states according to the state needs. We asked through the FEMA regional administrators for what you need and how we can support you. Some states need very little support, some states need significantly more support. Only 1 week after we started, we will have several starting today, and likely more than a dozen starting tomorrow. And to be very clear, we gave the initial allocation based on what your state told us, but we want you to work through your FEMA system. We have plenty of tests on the backside, we have plenty of supplies on the front side. Work through your FEMA administrator to give your requirements, and we will bring those back through the FEMA system to meet them. There's been great demand and a great enthusiasm among the states for these drive-through centers, primarily for healthcare workers, and we want to support you. We can certainly provide more than 5,000, but we didn't want to give away so much at the beginning until everyone got set up. Thanks, sir.
Thank you, General.
Great. Well, we're going to want to take advantage of the supplies that you're talking about, because the challenge out here is that while you all are providing test kits, we don't have, as you pointed out, the reagent, the swabs. We're having to go out on the market to find it, but it's being monopolized by this drive-through program that the federal government is doing. And we have drive-through that hospitals have stood up on their own, I might add. But the problem, again, is if we don't have reagent or the swabs, then we can't do more tests than we're doing today. The 5,000 that have been provided are being provided to Illinois for those drive-throughs are not enough going forward, and we really need, again, reagents and swabs in order for us to expand more rapidly. One last thing, our hospitals are doing just amazing work standing up, thank goodness, have their own testing capability, and of course our state labs too, but we really need the supply that the federal government has access to. We are competing with the federal government for. So
All
if you can help
right,
us.
General, that shouldn't be a problem. Would you please answer that, because everything should be in very good shape. Would you answer that, please?
It is absolutely not true that the drive-through centers are monopolizing the market. We use the swabs and the swab kits, not the testing kits. We get them through the commercial market. We use a very small percentage of them. When I was asked about shortages yesterday, I went right to the commercial market, got 200,000 and shipped them to the states that said they couldn't find them. So please look on the commercial market, because they are there. We will help you find them, or we will help you access them. And again, if you send your requirements up through the FEMA system, we will work with your states to acquire them or assist you in any way. We're fully integrated into FEMA now. It's been great. In only 12 hours, we've got us all side by side. So we want to help you. We appreciate the enthusiasm, and there will be more than 5,000 available to you either through the commercial market, or we will assist.
In fact, last night we bought 250,000 swabs, and they got distributed all over the country to the various states and the states that needed them the most. So, JB, any problem, call me up, but there should be no problem with that at all. Thanks a lot, JB.
Thank you, Mr. President.
Thanks, JB. Next, Governor, please.
This is Christine Elm from South Dakota. Thank you, Mr. President, Mr. Vice President, for all your hard work. We sure appreciate it. I want to tell you a little bit of my story, and I need to understand how you're triaging supplies. We, for 2 weeks, were requesting reagents for our public health lab from CDC, who pushed us to private suppliers who kept canceling orders on us. And we kept making requests, placing orders. The morning we would expect the supply, all of a sudden we get a cancellation notice, and we're working through all the set-up channels of the federal government to get it resolved until we ran out and were unable to process any tests in the state of South Dakota, because I have the only lab that is operating today. I have no commercial outside labs whatsoever. Then I find out this morning, after we had to get a little pushy with a few people, getting, thanks to the CDC, a shipment of reagents this morning and started testing again, which was good, as the backlog was getting there, and we were only processing and able to start processing this morning the high-risk samples as well. Found out that one of my hospital systems received reagents when they haven't even been an FDA-approved lab and aren't even ready to start processing yet. So they've received what I was trying to get for 2 weeks, when they're not even an approved lab, not even set up and running. And I'm trying to figure out how we're triaging supplies that we need, especially when I'm the only lab that operates in the state and we were going through the channels the correct way and using and searching and asking. I'm probably the one that my other colleagues were referring to that was asking for reagents from all of them for days.
All right, we hear it. We got you,
Trying
Chris.
to solve our problem.
Very good. Alex, please, would
Forgive me,
you
but
respond to
Howie,
that?
I just don't want to be not be a priority area because we're a smaller state or less populated.
That will never happen to you, and it will never happen to your state. Okay, go ahead, please.
No, absolutely, Governor,
Okay.
and
The
Governor,
second thing I need is
Governor, this is Secretary Azar. We absolutely want to make sure you get what you need there. There are many different reagents that can be used. So after this call, we'll get on with you to help make sure you're getting what you need. That hospital, I don't know how they got their supplies. They probably bought them on the open market. There's $1 trillion of open market supply. That's where most entities are buying. That's where hospitals buy their supplies from and states can buy from. But I'd encourage you first, please let that need be known to your FEMA regional director so that it goes into your normal process there. But given this special issue here that it's a CDC test, we're going to get on with your team right away after this call and we'll get that issue solved for you.
There
okay?
is tremendous supply. Deb, please go ahead.
So what might have happened is Thermo Fisher got approved. There's Thermo Fisher labs in major hospitals in South Dakota. And I told them to prioritize states that had not received Roche commercial assays and did not have LabCorp or Quest or one of the others. So your hospital, I'm not sure what you mean they're not certified. If they have a Thermo Fisher platform, they are certified to run this assay under full FDA. So there will be a lot of commercial hospitals in your state that will have access to these commercial laboratories outside of the CDC test. I understand about your state and local labs and them using, in your public health labs, using the CDC assay, but we're trying to strengthen your individual hospital's capacity where normal assays are performed for your public.
Thank you, Christy. Thank you very much. Next governor, please.
I have all these, yes, thank you, Mr. President.
Thank you, Christy. Next governor, please.
Can I just touch on two other things, Mr. President?
Go ahead. Go ahead. I think we got cut off. Next governor, please.
Mr. President, and Mr. Vice President, I want to thank you on behalf of Alaska for all the hard work you're doing. We're like other states, we're doing the best we can. I just want to reiterate the block rate concept, and then one last thing is the swabs. If under your new order under the basically the Defense Act, if we can get those swabs going, it's going to help us tremendously up here. But that's basically the request, and again, we want to thank you very much for what you're doing, and our thoughts and prayers are with our fellow Americans and the rest of the state.
Thank you, Mike. We'll take care of that immediately. Very quickly. All right? Thank you. Next, please.
Mr. President, Mr. Vice President, it's Governor Lujan Grisham in New Mexico.
Oh.
Can you hear me?
Yes. Hi.
Hello. First, in the last call, I was very specific about needing contact with the Vice President and several of your cabinet, Mr. President. That happened in short order. In fact, the Vice President, thank you. Mr. Vice President was in touch with us immediately.
Good.
And it has, in fact, made a difference. I do want to maybe offer a suggestion, and then quickly I have two more questions, if that's all right, Mr. President.
Go ahead.
The suggestion is this. You're correct that as we are all working on getting private sector responses to any number of supplies and equipment that both enable and continue to stand up laboratory testing and personal protective equipment, it is also true that the supply chain does still get interrupted, even if that's not a purposeful response by the federal government or anyone else. it would be very useful, I believe, to governors, certainly to me, if I knew what the federal government was ordering, if you knew what every state was ordering, and what the expected deliveries are, and we could do that through FEMA, because in fact, these competitive issues, I do think, create real challenges for states. I've had the same situation. Swabs supposed to come from someplace, get canceled. So exactly what Governor Nome is suggesting does in fact happen, and I think it's suppliers really trying hard to prioritize, but aren't all that effective at doing that.
I think that's good. I think it's a good idea. Pete, we'll do it through FEMA. You'll coordinate that. So Pete is here, we'll do it through FEMA. That's the way we want to do it, okay? What's next?
Second, I want to also echo how important it is to deal with Title 32 and to be clear about what we're doing with our guards. I spoke with Secretary Esper, and we want to stand up a combat support hospital because one of my units has been deployed to Poland. We are working with him on that. I need that to happen as quick as we can. I just wanted to make a plug for that and let you know. And then the last two things quickly. Governor Kemp is right on about grants. In my opinion, you've already, Mr. President, authorized that we can use community development block grants carryover. That may be a very productive mechanism with all the federal relief that you're engaged in to push out to the states because we can stand up small businesses immediately. And I would certainly like to be in a position to do that. And last, but as critical to us, New Mexico has any number of labs. We're in actually a pretty productive position as long as we get the supply chain worked out from swabs to the reagents or the enzymes that we need to run them through our high-capacity machines. Mr. Vice President, I'm still waiting on that Roche machine, so if you could call me after this call. The others are coming online, and I need the Secretary for the Department of Energy, and he's wonderful, Willett, to give us permission to stand up our lab at our national laboratories. If we get this done, we're doing as well as can be expected in this crisis, sir.
Thank you very much. We'll get it done. Thank you very much. All right. We have 4 more governors. Thanks. Let's go. Who's next?
Hi, Oregon is grateful for these calls, the ability to connect with your administration, and our needs are reflected in the NGA letter that Governor Hogan presented. Thank you.
Thank you very much. Okay, next, please.
Doug Burgum from North Dakota, also Chair of Western Governors. Mr. President, Vice President, thank you for your leadership. We had a previous call, brought up the risk in tribal area. Yesterday, the White House held a tribal call. Over 900 people participated on that call. You pulled together with Lighthouse leadership, the leaders of the BIA, the Bureau of Indian Education, Indian Health Services. There's more money on the way, so thank you for your fast response. Number 2, on behalf of Western Governors, you've heard it from Georgia, New Mexico, and Rhode Island, my colleagues there, but block grants to the states would allow us to move quickly to not only support small business, but really help support the economy and help solve this crisis. And then lastly, you made a commitment last week during this time of $25 WTI oil prices to fill up the petroleum reserve of the U.S. That will save billions of dollars. Great move. And again, thank you all for your leadership.
Thank you, Doug, very much. Thank you. Okay, next, please.
Mr. President, this is Steve Sisolak from Nevada, and I appreciate you having this call. I'd like to ask one big thing of you. I know that you're looking at potential recovery packages already in stimulus, and we talked about the airlines and the cruise ships, and I would like you to consider including the hospitality industry in that. I have unfortunately had to shut down the Strip in Las Vegas, and tens of thousands of hospitality workers have been displaced as a result of that. And while they're getting some compensation and filing for unemployment, anything to help we could get from your end to help with the facilitation of getting our economy back going again would go a long, long way. This is our number one industry in Nevada. And
Yeah.
I know we've got other parts of the country with the theme parks and whatnot, and these folks are lower wage sometimes. It would definitely be helpful if we could include them in any recovery package that is brought forward.
I think it's a great idea. Thank you very much. I think it's something we'll be thinking about it. Thank you, Governor. Next, please.
And this is our final question.
Mr. President, Brad Lowell in Idaho. The governors, we talked about the ventilator crisis as we get further down the road. I know Governor Inslee is there at that point now. I've heard rumors that the car industry might start manufacturing them. And then we've talked about using laser technology, laser printing to make the parts. If FDA would give us the standard, and if Congress and the administration would help us with patent protection so that we could get into the supply chain an adequate supply of ventilators and the filters to where that was one less thing we had to worry about in our supply chain going forward, that would be very helpful.
Okay. And we can do that too. That's great. We can do that easily. Thank you. Thank you, Brett. Well, ladies and gentlemen, thank you very much. It's been an honor to be with you. We'll do this probably often until this gets solved. Feel free to call me, the Vice President, anybody at the table, anybody in the room, except for the media. Don't call the media. And we will see you at the next one. Thank you all very much. Thank you.